Hello juniors, so I welcome you all again in the continued series of general anatomy, and today we are going to discuss an easy yet an important topic from university point of view, which is the cartilaginous joints. So without wasting any further time, let's move ahead. So generally speaking, there are 206 bones in an adult human body, and bones are held together with the help of ligaments to form joints. And this you all must have studied in your bio classes. But when you enter the medical field, those joints get further classified or diversified into many types such as synovial joint, fibrous joint, and both of them I have covered in my separate video in detail. And today we are going to cover a third type of joint, which is the cartilaginous joint. So you all must be knowing that bones are held together with the help of ligaments, and this is the example I have taken of hip bone, which is attached to the femur with the help of these ligaments. So basically many joints in human body are attached with the help of ligaments, but there are some bones which are held together with the help of cartilage, and when they form the joint, those joints are called cartilaginous joint. So once again, cartilaginous joints are those joints which are held together by cartilage. In cartilaginous joint, there is absence of synovial cavity. Now I've already discussed the synovial joints in my another topic, and there I have said that synovial cavity is the hallmark of synovial joints. This is the synovial joint and synovial cavity is its hallmark. So therefore in cartilaginous joint, synovial cavity is absent. Further, there are two types of cartilaginous joint. The one is synchondrosis and the another one is symphysis. We will discuss them both one by one in detail. So starting with the first type of cartilaginous joint, which is the synchondrosis. Synchondrosis joint is also known as primary cartilaginous joint. The connecting material between the two bones is a plate of hyaline cartilage. You have to remember the word, the hyaline cartilage. This is the key cartilage involved in the synchondrosis type of cartilaginous joint. So basically, if this is the bone A and this is the bone B, both the bones are held together with the help of cartilage, and this cartilage is mainly the hyaline cartilage. This is the hyaline cartilage, and this cartilage is present in between the bones in the form of a plate. So I have made a plate for you so that you can remember this thing, that the cartilage which is holding both the bones together is in the form of plate, and the cartilage is hyaline cartilage. So what is a hyaline cartilage? Hyaline cartilage is a glass like and translucent cartilage found on many joint surfaces, and this cartilage helps in easy movement of joints. Synchondrosis type of joints are temporary in nature. Here temporary in nature does not mean that your body will collapse something like this. Temporary does not mean that. Here the temporary means that after a certain age the cartilaginous plate is completely replaced by bone. So what I was telling you, if this is the bone A and this is the bone B, and both are together held with the help of cartilaginous plate made up of hyaline cartilage, then after a certain age the cartilaginous plate get completely replaced by bone, and this process is called synostosis. This process is called as synostosis. You have to remember this is a buzzword. So reviewing once again all the points of synchondrosis type of cartilaginous joints are: this joint is also known as primary cartilaginous joint. The connecting material between the two bones is a plate of hyaline cartilage, and joints are temporary in nature. The temporary word means that after a certain age, the cartilaginous plate is completely replaced by bone, and this process is known as synostosis. Now coming to the examples of these joints. So where are these joints found in the body? And the first and most important example of this kind of cartilaginous joint is the epiphysis and diaphysis of a developing bone. So you can see this is the femur bone, and this is the epiphyseal cartilaginous plate of hyaline cartilage. So this cartilage is holding the epiphyseal part of the femur bone with the diaphysis part of the femur bone. And until and unless this cartilaginous plate is present, your femur will continue to grow. So this cartilaginous plate continue to divide in both the directions. So until like in your 20s and or you are still a young adolescent, your cartilaginous plate will be present and it will continue to grow. So my key advice to all of you that go hit the gym floor, be at least 6. I am myself 6'4". So get your femur bone longer before this epiphyseal cartilaginous plate get fused up to form a bone. The second type of example is the xiphisternal joint. This is the xiphoid process of sternum, and this is the sternum body, and this is the manubrium of sternum. So the joint between the xiphoid process and the sternum body, the joint is also being held by the cartilage, but over the time when you get adult, this cartilage get converted into the bone and get fused with the main body of the sternum. And lastly, the first chondrosternal joint. So the chondrosternal joint is this joint where the first rib meets with the sternum. This is the sternum, this is the first rib. So in early stage of life, the cartilage is holding the rib and the sternum both together, but as you get adult, this cartilage get converted into bone, and that process is called synostosis. So here I have an example for you. This is the X-ray of a child showing the femur, and this is of adult. Can you appreciate the difference between both of them? If yes, well and good. And if you are not able to appreciate any difference, I am here for you. You can see this is the femur. This is the femur bone of a child. Right here is the femur bone, and you can see a discontinuity in the femur bone. This is the epiphyseal part of the femur bone, and this is the rest of the diaphysis part of the femur bone. You can appreciate this gap. This gap represents the epiphyseal cartilaginous plate in a child during his growth stage. And until this epiphyseal plate is present, his femur will continue to grow. Now you can see the femur of an adult. This is the femur bone of an adult. Here you can see the femur bone is continuous throughout, and you can see no epiphyseal plate right here. You cannot see any epiphyseal plate right here because the femur has stopped to grow, because the cartilaginous plate has become a bone and get fused with the both of the bones. So these are the example of primary cartilaginous joint and their evolution over the time, which are also known as synchondrosis. Now coming to the second type of cartilaginous joint, which are known as symphysis. So symphysis is also known as fibrocartilaginous joint or secondary cartilaginous joint. These joints are permanent and persist throughout the life. So basically up till now in synchondrosis you have seen that the cartilage get converted into the bone, but in symphysis the cartilage remains as such throughout the life. These joints occur in midline of the body. Here you have to remember the midline. Many a times examiner asks the location of symphysis joint. It is generally in the midline of the body. Joints are slightly movable, or this are called amphiarthrosis, means they are slightly movable. And the example of symphysis type of joints are between the vertebral bodies. The joints between the vertebral bodies. This is our vertebrae, and this is our another vertebrae. So this type of cartilage, which is also known as intervertebral disc in the vertebral column. So this cartilage is our fibrocartilage, They are permanent throughout the life and persist throughout the life, and they show very slight movement. So as you can see, you can only slightly bend your back because of the slight movement of this fibrocartilage. Secondly, the pubis symphysis. So this is the right hip bone and this is the left hip bone, and they both are connected anteriorly or held together anteriorly with the help of the fibrocartilage. This is the fibrocartilage, the blue color band, and that joint is called as the pubic symphysis. So basically this joint remains throughout your life, it does not get ossified, and it shows a very slight movement. Thirdly, the manubriosternal joint. So this is the manubrium of sternum. This is the sternum body, and this joint is the manubriosternal joint. The cartilage present in between the manubrium and the body of sternum is the fibrocartilage, and this cartilage also persists throughout the life. Now completed with both the type of cartilaginous joint, which are synchondrosis and symphysis. I hope you found this video helpful, and since this is an easy topic, many would face no difficulty in remembering this. But when I was in my first year, the way I used to remember the features of synchondrosis and symphysis with the help of this way. Synchondrosis is also known as primary cartilaginous joint. So I used to remember the word primary, and I used to correlate the word primary with the primary stage of life of a child. So initially these cartilaginous joint are present in the primary stage of life of a baby, but they later disappear. And the symphysis type of joint, also known as secondary cartilaginous joint, I used to remember the word secondary is that they are present throughout the secondary stage of life. The primary stage of life there was symphysis type of joint, and secondary stage of life, which persists throughout the adulthood, the joints are present and they persist throughout their life. So done with both the type of cartilages. If you found this video helpful, do like it and do share it with your friends. And if you are present till here and you found this video helpful, subscribe to this channel. Thank you.